I'll get started just with the introduction. So hi everybody, and thank you so much for joining us today for this webinar on tackling social isolation and looking at the health and the well-being implications. So I'm Berenice. I work at the Bromley by Bow Centre. I'm with the Knowledge Share and Exchange program, so I organise those webinars. You might have seen my face before if you attended some of our webinars in the past few months. So as you probably all know, we're looking at tackling social isolation today. So as we know, it's worsened during the COVID-19 crisis within our communities, including for members that were already experiencing it prior to the pandemic. So many factors can cause people to be socially isolated. That includes a language barrier, mobility issues, digital inclusion, being out of a job, etc. There are many, many reasons why people can feel isolated. We measure here at Bromley by Bow Centre the needs of our community based on the Unleashing Healthy Communities research. And one of the 6 crucial outcomes for a thriving community is being connected to others around you. So that's definitely a crucial part of people's well-being and health. So social connection or isolation can have a major impact on one's mental well-being and physical health, and several schemes and initiatives are already in place to tackle this growing issue, such as social prescribing or programs such as befriending schemes and this kind of thing. So today we're going to look at different things, how we can kind of identify isolated members of our communities, what can be done to engage with people who are not usually connected to them, and what can we find out about local initiatives and making sure that this is a collaborative approach. What have we learned during the pandemic about coping with social isolation, and how can we take the existing initiatives to the next level from where we're at now? So like you can see on the screen, so please keep yourself on mute at all times to avoid any background noise. And we're recording this webinar, so a recording will be sent to you just after the webinar, as long as the slides. And please feel free to introduce yourselves, like some I've already started to do, in the chat box and ask your questions. I'm keeping an eye out on the chat box at all times, so please do feel free to put your questions there, and I'll make a note, and then during the Q&A we'll be able to ask our speakers. So today's agenda is first looking at kind of some case studies. So first of all, we'll be with Alice Everett, who is Wellbeing and Development Manager at Bromley by Bow Centre. She'll be presenting about the mental health implications of social isolation. Our GP partner, Professor Sir Sam Everington at Bromley by Bow Health, will be talking about the health implications of isolation. And finally, Yolanda Gyoni, who is the Active Together Coordinator, Community Connections at Bromley by Bow Centre, will be talking about tackling social isolation thanks to online activities and social groups, and also live activities like face-to-face activities. Then we'll have the Q&A with our panelists, and finally, we'll have a little think together activity, just some breakout room session, and some feedback with everybody just to discuss the impacts of social isolation and what our thoughts are. So we're going to get started with Alice. So Alice, I think you should be able to unmute yourself, or I'm going to ask normally. You should be fine. All right, so Alice, I'll hand it over to you.
Thank you. So yeah, I'm Alice. I'm the Wellbeing and Development Manager at Bromley by Bow. I've just got a few minutes today to talk about the mental health implications of social isolation. I think we can all agree this is a huge area, as is talking about mental health and COVID. So obviously I'm only going to be able to touch on a couple of themes here, but hopefully it will just help you to be thinking about things. And there's huge amounts of information online, so if you do want more information, then there's plenty out there. I guess just sort of first off, you know, in relation to COVID, we don't yet have accurate figures of the, you know, mental health implications, and I think we can all agree that they're multifaceted and will be impacting on our culture and our societies and globally for quite some time. You know, as people adjust to changes, people lose jobs, people lose family members, you know, so it's such a huge area. But I'm just going to focus in then on social isolation and mental health. So if we can go to the next slide, Berenice. So I think, you know, we're all aware that social isolation does impact on our mental health. You know, we're talking about COVID and the recent pandemic and the lockdowns, but, you know, for many, many years, people have been doing various experiments, you know, into the impact of isolation on human beings and actually other species as well. And we also have real life cases and real life experiences to draw from. I think a lot of it is probably common sense. And I think, you know, we all know and accept that being isolated from other people, from being disconnected, can really impact on our mood, and, you know, it can result in feelings of depression for people. It can really impact on things like anxiety, stress and worry. It can affect a lot of our sort of body functioning, so things like sort of poor sleep, appetite. It can also cause substance abuse for some people. And it can also impact on cognitive decline and perceptual changes. So even things like our sense of time can change if we're isolated for a long period. Again, probably quite obviously, isolation might mean that people experience new episodes of mental health issues that they've never experienced before. But equally, it can really exacerbate existing issues that some people might have been living with for years. So obviously there are many mental health issues that people can be living with. This is just a very small list, but you know, it makes sense that being isolated and cut off can exacerbate any of those experiences. Also, I just think to hone in just a little bit more specifically, you know, COVID has triggered more health anxiety for people. So I'm talking about COVID, I know we're talking about isolation, but I think it's interesting to think how those two come together. And also things like people living with OCD, particularly with fears around contamination. You can imagine how sort of COVID and then the subsequent isolation would really, you know, really impact on that for some people. So if we can go on to the next slide. One thing I just wanted to spend a moment reflecting on is, you know, we often talk about various sort of labels, various sort of diagnoses and, you know, how they might be impacted. But I also think it's important to think about what we call sort of secondary suffering. I think that term may have originated from Buddhist thought originally. I might be wrong, so I'll happily look into that and find out where that came from. But it's talked about quite a lot in relation to mindfulness. And this is when, you know, people experience primary mental health issues, and we all know that at least a quarter of the population experience mental health issues at some point. But the secondary suffering is then all of the, if you think of all the sort of negative self-appraisal, self-criticism, negative self-talk about oneself and one's own experience. And when you're in isolation, quite obviously, you've got a lot more time to actually dwell on things, to reflect on things. And if you're prone to thinking negatively about yourself, you might find that you're blaming yourself for being isolated. Even though there's a pandemic, you might be thinking, well, if I was a nicer person, I might have had more friends, I might have had a family, you know, it's my fault I'm in this situation. So as well as the, you know, pre-existing mental health issues or the new experiences, you've also got this second layer of human experience that can exacerbate a lot of these feelings for people. So if we could go, and thank you, Berenice. Now, one thing I did want to mention is we're talking about isolation and the impact on mental health, but I think as Berenice has already sort of mentioned in her intro, actually mental health issues themselves can lead to isolation. So COVID has meant greater levels of isolation for a lot of people, but there are lots of other things that create isolation for people with mental health issues. So it feels important to mention the stigma of mental health. This is an ongoing cause of isolation for many individuals. We've just got a snapshot of, horrendous front pages from, tabloids stigmatizing mental health. So if you experience mental health issues anyway, there are lots and lots of things that will lead to you feeling disconnected and cut off from the community around you. It's also really important to mention the intersection of race, of gender. I meant to put gender and sexual identity there, and disability, and there are many other things as well that people will experience on top of having mental health issues that may well have caused the mental health issues, but certainly, when they all align, it's a very, very sort of difficult, problematic experience for a lot of people. I'm talking very quickly because time is of the essence. One thing I wanted to just say, because obviously sort of reflecting on, how we might support people who are isolated. I think basically, I personally sort of feel, I think outcomes are really important. And again, Berenice has talked about our 6 stretch outcomes, that we sort of work towards. But I think when we're talking about a sort of deeply human experience, it's really sort of important to be mindful of moving away from trying to quantify every aspect of that and talking about a human experience in a really sort of clinical way. And when you look at things that are talking about isolation, you might come up with these things like, people are talking about, what's someone's network diversity, what are their frequency of interactions, social network styles. And I think whilst it's important to take these things seriously and in a bid to looking at how we can sort of measure situations, and start to instigate change and measure change. But I also think just for a moment, we all need to just sort of step beneath all of that and stop and reflect on what we're all really talking about here. Are we really talking about loneliness? Are we talking about something deeper, something more existential, something about that existential loss of connection, of purpose, and of community? So again, it's not saying throw the outcomes out of the window by any means, but it's just trying to never forget the sort of human side of what we're talking about, that deep existential experience of feeling isolated. So if we can go on to the next slide. So here are just some general thoughts about, how to support people who might feel isolated, what things that, are important to consider when we're looking at our services or the way we work. And again, these might all feel like quite obvious things, but I think often the most simple things are the most important and most effective. It's basically about giving time, space, empathy, and compassion. It's about creating spaces for really meaningful, authentic connections, organic connections to happen. None of us can just, put a group on and stop somebody feeling isolated. It's about providing the spaces where people can actually connect in a really authentic way. Again, talking about things like effective outreach, connecting with community members, taking a really joined up approach to trying to be more inclusive in the work that we do. It feels really important to remain person-centred at all times. I'm sure I'm preaching to the converted, but never to forget to actually really centre the people that we're talking about. Giving people the time to actually reflect and understand for themselves what they want or need. We all know that we're not talking about a homogenous group here. We're talking about lots of different types of people who might be isolated and might be experiencing mental health issues. I also think it's about generally having a consistent, open dialogue about things like loneliness and things, talking about isolation. It's about trying to have these conversations and get rid of any sort of shame around these things. Because whilst we're talking about, COVID and a sort of shared global experience that might lead to isolation, as we said, there are lots of other reasons why people can end up feeling that they're isolated. So it's about validating that experience. So I don't know if I've rattled through that. I don't know how I did time-wise, but that's all I'm going to say today. I'll leave it there. Thank you.
Thank you so much, Alice. That was really interesting, and that was really insightful, and I think needed to get started with this webinar and this topic specifically. All right, so we'll move on to our GP partner, Sam Everington. I think I can unmute yourself. Yeah. You should be able to speak now. Hi, Sam.
Hi, thanks, Bernice. So that was fantastic, Alice. And I'm going to try and add to it and not go over the amazing things you have focused on. Social isolation, you need to think about it in terms of the physical, mental, and social impact it has on your health. So Alice has covered a lot of mental, but actually think physical. Let me give you some examples. This is, if you take an 80-year-old and you put them in a hospital bed for 10 days, they'll lose 10% of their muscles, and that's the equivalent of 10 years inactivity, okay? Now, you might argue that putting somebody in a hospital is not social isolation, but imagine what's happening to them at home in the same process, that they're not going out and they're not being physical. Bottom line is, if you're not active, 10 years loss of life, okay? And that's physical loss of life. So social isolation is not just a mental health construct, it's the physical and mental combined, which is really, really important. Let me give you another figure, that actually once somebody's become housebound, the life expectancy is typically about 6 months, the average life expectancy. Yes, it's pretty frightening statistics, okay? So the answer to everything is keep active mentally, physically, and socially. You know what I mean? If you want a longer life, but actually in some ways, more importantly, a happy life. And Alice, I think, very much focused on the issue of quality of life. If you are inactive and or stressed, which goes hand in hand with social isolation, we know that you are more likely to get cancer, but actually in some ways, more importantly, it's gone down to a cellular level that shows that actually you are less able to repair your cells, which is quite critical in preventing and or your body dealing with cancer. So it's very stark, actually. It's very stark, this issue of social isolation. Diabetes. Okay, so what's the best treatment for diabetes? So most people think, oh, well, it's the insulin or the metformin that we prescribe. Then people might say something like, it's how much you eat and your weight. But actually, most importantly, it's activity and weight. The two are directly connected, by the way, absolutely connected. And actually, I would say to you that actually dealing with those lifestyle issues are far, far more important than anything I can prescribe as a doctor. One of the things you might want to read, I'll show you the book. It's called Lost Connections by Johann Hari. And there's a whole chapter, actually, he interviewed me at Bromley by Bow. But do read this book. It's quite stunning. I never thought much of it. I spent 2 days with him, oh gosh, about 6-7 years ago. And didn't think much of it because I do lots of interviews generally. And, but he's got quotes here from Elton John. He's got quotes from Hillary Clinton. This goes around the world. And I can't tell you how many interviews I get from newspapers around the world on the back of this book. What it's focusing on is actually the non-medical interventions in mental health and how important they are. And that's part of the social isolation story. But let me start by telling you that antidepressant prescribing has doubled in the last 10 years. That's a pretty horrific statistic. And actually what you're engaged in, you don't, in some ways you might not realize you're doing this, is quite a revolution in mental health treatment, okay? So typically if somebody goes to see some GPs, actually it was always, you're depressed, you're anxious, you've got OCD, here's an antidepressant. if you come and see me and a lot of my colleagues now, it's very, very different. The first discussion will be a whole raft of issues around your job, your education, your environment, who's close to you, your stress at work, what you eat. And actually, very rare to start antidepressants on day one. There is circumstances where you would, but actually following a patient, typically, I'll give you an example, in a week's time, where you kind of jointly set tasks which are achievable, like cooking a meal every day, or going for a walk for half a mile every day, has a dramatic impact actually on them the following week. Because when you're highly depressed or highly anxious, it's just, you sit, there's no way out. You can't, it's like being in a dark cave and you can't see the entrance. And you can't see that you can actually turn this around. And just the simple question then a week later of, have you managed to do a bit of walking, or have you, have you cooked something, or are you eating more healthily? And actually the response invariably is, yeah, I am. And so I will say something like, oh, that's fantastic, well done. Do you know, in that whole process, you've empowered them and showed them that actually there is a way out of this. And then actually the conversation about drugs is far, far more reduced. Really, really important, this actually, because the tragedy of the destigmatization of mental health, which is absolutely crucial, is the biomedicalization of it. So you see nationally and even locally in health systems, people are saying, well, we've got to have more nurses. We've got to have more psychiatrists. Well, this is biomedicalizing it. Actually, what we need is more of you, because actually you are, and I don't say this lightly, are far more skilled at helping people with mental health problems, with social isolation, of resolving their issue, because you take a holistic approach. The only thing you don't do is prescribe, but do not underestimate the power and influence you have on people's lives. The other thing I always like to remind people of is the health service is only really responsible for 20% of people's healthcare. And tragically, although I'm CCD chair and spend all my time talking about health in its widest sense, focusing on school-aged kids, all sorts of raft of different things. Actually, somebody's job, their education, their creativity and their environment is absolutely critical. I'm part of the National English Gardening Scheme. And if you ever get the chance, do go to their conference. Utterly amazing. So I was invited and got involved by their chief exec, who's an amazing person, about 6 years ago. And he'd been to Bromley by Bow, loved what we were doing, and said, well, why don't you come and give this the keynote speech at the annual conference? Now, the English Gardening Scheme is amazing people around the country who open up their gardens to the public. They charge, but the money all goes to charity. And what was amazing at that first time 6 years ago, because I did it last year with Fatima Uddin, who's some of you will know at Bromley by Bow, who's one of the advocates. And what was amazing the first time I did it 6 years ago, the person who came on before me had done a study of all the people who visited gardens and asked the simple question, why have you visited? What did you get out of it? And everyone was sort of expectant that it was all about the flowers and the seeds and how you plant out gardens and all sorts of things. Any ideas what it was? Mental well-being. It was quite extraordinary. And the other thing, when I talked about this holistic approach to healthcare, what I saw in front of me, by the way, these are all people who are, a vast majority of them retired, and they're in their 70s, 80s, and 90s, okay? But what I saw was a crowd in front of me that were live, young, youthful, and almost entirely not overweight. It was quite extraordinary. I mean, in front of me was the answer to so much of the health issues. If I could get every one of my patients to garden, I would do far more than them, far more than anything I can ever prescribe. It's just quite extraordinary. If you take heart attacks, for example, as an example, you might think that you've had a heart attack, and to prevent a further one, the drugs you go on, the beta blockers, the cholesterol tablets, all these sorts of things are the most important thing. No, they're not. Exercise. Exercise is far more helpful in terms of prevention. Now, social isolation is, you can see it very easily in terms of elderly people who don't have friends. And clearly, we all at the centre do a lot of work with this group. Quite often too, in recent days, of course, it's the high risk group with COVID, isn't it? And typically that will be a similar sort of group. But I would, and I probably don't need to say this to you, but actually people can be socially isolated and live in households. Really important to understand. And how do we help deal with that? And you're doing it naturally. But I can't help noticing all the time the social isolation of this community. In that the typical lifestyle is you live in a flat, which often is overcrowded. You walk outside your door, you jump in your car, you drive to the school and drop your kids off, you go to the supermarket and you go home. That is a massive poverty and social isolation. And not always about economic poverty, by the way, quite extraordinary. I can't tell you how, so 30 years ago when I started as a GP, there were virtually no cars in Tower Hamlets. Social housing was 85%. It's probably around 40% now. And actually, in many ways, people were a lot more active. They had to be. They didn't have cars. Cars have been the bane of this community, absolute bane of this community, actually, in terms of walking and looking at your environment, seeing what's around you. Actually, even an inner city area like Tower Hamlets is quite fascinating. And of course, that was one of the things that happened during COVID, actually. A lot of my patients talked to me about how they said hello to more people, how they walked on the streets, how they saw more of their environment, some of the rich history of the East End, the secret places like Tudor Lodge on the Tudor Lodge on the motorway, for example. There's tons of hidden gems in Tower Hamlets. COPD, exactly the same. If you're isolated, you're at home, you're not active, guess what? Your chronic lung disease is going to be far worse. So in summary, social isolation is about individuals, and often elderly, that are isolated at home. But actually it's also about whole households that actually are very isolated from the opportunities that we take for granted. I've just been up in Norfolk for a long weekend, you know, walking on beaches and things like that with wind in my ears. Do you know what I mean? How many of my community do that? How many of my community go out to what I call our branch in the Cotswolds, Stanton Guildhouse, which people like Andrew, and Frank Craber, treasurers of, middle of the most gorgeous Cotswold countryside, picture postcard village, where just being there makes you feel a lot better. And how do we give the taste to our community of this so they want more, they desire more? How do we give them that aspiration that tackles social isolation? You know, when you're depressed, finally, you can't see a way out. You can't, but actually you don't have the energy or the concentration even to go and taste other things. And so to me, what Bromley by Bow has always epitomized, Andrew Mawson always says this actually, is if, I mean, he says it in terms of wine, I'm afraid. But if you are always used to drinking plonk and never tasted champagne, well, how would you know any different? Now, the parallels is, you know, have you been to a beautiful garden? Have you seen a cow in the countryside? You know what I mean? Have you tasted that? I mean, I go swimming every day, for example. That's the thing that that keeps me non-isolated and keeps me energetic and enthused. And finally, remember that physical, mental, social health are entirely connected. And I'll go back to one of my main points, is that what you do is 80% of healthcare, because actually what you're doing is focusing on people's education, either because you're part of the education process or you're encouraging them into education. You're part of employment. Get a job, you will be healthier, full stop. Yeah, I know there's some shitty jobs out there, do you know what I mean? But the general principle, get a job, you're healthier. Creativity, I mean, just the beauty. I mean, I have, my whole flat is full of art and paintings. Just looking at them is just, it's beautiful. It makes me happier. And finally, the environment. And that's what's around you. What's in your block of flats? Is there a garden? Is there an allotment nearby? I notice opposite St Andrew's Health Centre, where I do most of my clinical work, in the allotment garden there, I see all my patients there. And guess what? They're not necessarily the ones who haven't got chronic illness, but they are the ones that are happier and healthier.
That sounds great. Thank you so much. That's very insightful, and yeah, very important to remember that mental and physical health are very, very linked and always go together. All right, so we're going to move on to our colleague Yolanda. She will talk about different activities that she's been organizing at the center to help people kind of feel more connected with their community and others. Yolanda, I think you should be unmuted now. Are you able to share your screen, or?
Yeah, hi everybody. I'm gonna try and share my screen.
All right, I'll
try. Try to share exit the screen. So
I can also see that I don't know if some of you haven't noticed, but the link to the Amazon for the book Lost Connections is immediately been put in the chat, so that's quite cool. Everybody is quite keen to read your recommendation, Sam. So that's good to see. All right, Yolanda, are you?
I'm not sure if that's worked. Oh, brilliant. So hi, everybody. My name is Yolanda. I am an Active Together coordinator for this program called Active Together. I guess what it does is what it says on the tin. Basically, what we do is we work with families with children 5 to 11 years old and their siblings, if they've got younger siblings or older ones. The central theoretical model of this program is that if you get a family to be active together in a safe, fun, stimulating environment, it will have long-lasting positive effects on the children, on the children's attitudes to activity, being physically active in the longer term. So the role modeling, the positive role modeling is quite powerful in reinforcing healthy behaviors such as being physically active. And children witnessing trusting adults participate in and enjoy activity as well. These children are more likely to grow up into more active adults, will adopt healthier behaviors easier, and it's actually quite powerful and liberating for these adults as well that join into our program to have an opportunity to, or given permission, if you like, to play and join in games. So this is the program we've been delivering at the Bromley by Bow Centre for the last 2 years now. And we've had around 170 families that we've worked with over the last 2 years. And come the lockdown, obviously we had to try and keep a sense of community, because a lot of the families that we worked with, they lost that sense of routine due to schools closing down. So everything familiar to them was almost out of reach. And from my perspective, actually, the children that were kept at home, they lost the sense of routine, and I believe they felt that sense of social isolation quite keenly. they felt isolated from the friends, the teachers, the familiar environment that they spend most of their day in, their after school clubs, and all of it went down. And so we gathered very quickly a timetable of activities, looked very similar to what I have on the screen now, but we had a morning, afternoon, early afternoon sessions and later afternoon sessions that we were delivering online. And we were hoping to offer these families that had gone through our program, we were hoping to offer them a sense of stability, routine, a chance to have fun while being active. And the program, we were trying to get the program to offer a best of both worlds to these families. So for the families that were craving a sense of community, a sense of getting together, they could come online and they could see another 10, 12 families there joining in. And for the families that actually are a little bit more shy, or the children that didn't feel like they could jump in and join with other kids, for a lot of them, they felt that being online, doing a session online, it gave them almost a one-to-one sort of sense of an activity. So we've been delivering this program, this new blended activity, from April onwards, and we kept it going over the summer as well, and in cooperation with our Facebook virtual program, the family playrooms that my colleague Naomi delivers, we invited all of the families in my program and also all the families in other programs as well. We invited them to come along and participate into it was called the Summer by the Sea Activity Pack initiative, where each family came along and got a pack of activities that they could do at home as a community, but in their own homes for 6 weeks of the summer. And physical activity was 1 week out of those 6. Creativity, gardening were other parts of the pack. So as part of the packs, we offered them skipping ropes. So we handed out around 500 to 600 skipping ropes. So each child got a skipping rope, and they really loved it, enjoyed it. And we did sessions incorporating skipping ropes and incorporating indoor activities. So anything that families could do, bearing in mind that they probably wouldn't have a lot of space available to them, a lot of equipment available to them. So we just kept it nice and simple and just fun and interactive. And we deliver sessions every week using a variety of platforms. So we use Zoom, we use Facebook, and use YouTube Live. We are now moving on to trying a blended, as you can see from the timetable, there's a blended delivery. We've got a couple of sessions that we are doing face-to-face. We've got a Saturday morning, a cycling session in cooperation with a company called VTube and some of our projects in the Bromley by Bay Centre, so the community is driving change. This is a face-to-face, so families can go along, bicycles are provided for them, and they go along and have a ramble around the marshes for an hour or so. They are active, they get together as a community, they get along, they meet new people, but they also bring friends and family along. So it's a really lovely program that we've got going for families that are wishing to do things outdoors. We've also got have the online provision. So Monday to Thursday, we have tried to adjust our timetable to deliver activities after school, since many of the children are back in school now. We're trying to get the family to be active together at home, because we're not sure how much PE they're getting. We're not sure if there's any clubs going in schools, because the schools they've just started, so they're quite preoccupied with health and safety and keeping things as smooth as possible with minimizing COVID risk, obviously. So we've got provision, so sessions for them starting after school time. And we're hoping in October to start another face-to-face program. But that's obviously subject to whatever comes out of today's announcements. So yeah, this is what I've been delivering to try and tackle isolation and community that I deliver.
That sounds great. Thank you so much, Yolanda. There's straight at the back of this a question for you about who are the people delivering the activities? Do you have volunteers or paid staff to do the physical activities? How does that work?
So what happens is we've promoted this because up till now we were delivering to our current cohort of families that had gone through the program, but we're opening this up now to new families. So we would be really happy to have new families come along. Any families in England, really. Sports England are our funders. So any families in England are welcome to join, especially to the virtuals. Maybe the cycling is a bit far out of reach, but definitely the online sessions are open to all families. And we have utilized a really good group of local self-employed coaches who know the community. They know the barriers and the challenges that families face when trying to access online. So we've got a lovely group of trained coaches that are self-employed. We also work with volunteers when we're trying to do promotions, or when we are working with schools or working with community centres. We have volunteers who will come along with us and see how things are delivered and give us a hand, whether that's leafleting or talking to people or advocating for us to their children's schools. So we've got a number of volunteers as well that are engaged with our programme.
Right, that's helpful, thank you. And so someone's asking as well, a couple of people are asking, how do these activities respond to the changes in social distancing measures? How is that dealt with?
So the cycling groups, they're all met outdoors, and they're put into groups of 6. So they create their bubbles there and then, where they go in groups of 6. They don't mix. There's a leader in the front of the group who kind of keeps their distance but goes along and sees if there's any issues with the cycles. So we're keeping it as safe as possible. These are keen cyclists, so these are people that know how to cycle already, even children who are a bit proficient in cycling, so they shouldn't need any help. But if there's cases of first aid, of course, we follow all the COVID guidance and rules to come to their aid.
Thank you. Thanks, Yolanda. Right, I think that's a question for all 3 of you. That you could all kind of chip in, but it's how can we encourage people at risk of loneliness to take part in outdoors activities? How can this be approached? Is it, for example, Sam, maybe if you have a patient that comes to you and you notice that they might be lonely and that might be a problem with their health, how do we approach this?
Is that a question for me?
That's a question for everyone. I think everyone could like say what they, from their own experience, it's been like. But I think, yeah, originally.
I'm happy to just chip in with a thought off the top of my head, really. It's just to acknowledge that I think if you are feeling socially isolated and everything that goes with it, to suddenly go and join a group can be really challenging. You might just not naturally be a group person anyway. And I realise it's down to resources, but I guess it's trying to look at a variety of options and activities. Is it possible to have some one-to-one support and help and groups? Again, I know that's timely and costly, but just sort of looking at different ways things could be offered. But I feel like I'm kind of treading into Yolanda's territory here, but just to acknowledge that it's not easy for people to join groups all the time,
And someone's also mentioning fear, how a lot of, especially older people, are afraid of going out now. How can we tackle this as well?
I can just say something from my experience, because before I was delivering for families, I was actually delivering a public health program which was called Can Do, and it's encouraged communities and informal groups to come together to design a scheme that would work to decrease somebody's mental health load, reduce isolation, improve their health and well-being. And one particular program which I found really inspiring was this project called Roman Road Curry Nights. And this local community cafe in Roman Road, for those of you familiar with the borough, what they did is they opened up their cafe one evening a month, and they offered the residents living around the cafe to come along for a free curry. And the only rule was you didn't sit at a table with somebody who you know. So you had to go and join a group of strangers and strike a conversation. And it was a really successful project. One of the best parts of that job was going in and talking to the volunteers who led the project, and to see their passion and their utmost respect for these people that were coming out of their familiar comfort zones to come along and meet new participants and new residents. They had people of all ages joining into the scheme. They did I believe there were 6 evenings, 6 months that they delivered this curry night, and they saw different people most times. And it was a lovely thing to meet new people, and people got their feedback, so they gave their feedback afterwards, and it was really rewarding to hear that people had come out of their comfort zone. A couple of elderly ladies joined, and they really loved being part of it, and sort of strike the conversation and strike the connection with somebody else brand new out of the evenings that they joined at this Roman Road Curry sort of evening. So yeah, that was one way of trying to get people out. It was really a lovely project to see.
That sounds great. Yeah, that sounds like a very nice project. But I think also one of the problems that we are facing now is like how scared people are of meeting new people as well. How can people are not really, because of the virus and things like that, it's very difficult in that sense. How can we tackle that?
I
Do you have any
guess,
thoughts?
sorry, I mean, this is probably more of a wider thing, but I guess if it's sort of managing fear and anxiety, it's about looking at what sort of tools we can share with people, for want of a better phrase. It's making sure that there is support for people. I know we talk about self-care a lot, but it's making sure people can access good information and techniques and supports about managing those feelings, because I think with all of us, we can't change what's going on around us, but all we can control is sort of how we respond to things to a degree. So just making sure that there is, sort of common mental health support for people, so they at least know how to be able to support themselves and manage some of those challenging feelings.
There's also a very interesting question, so I'm just going to read it out if that's okay with everyone. So from a social prescribing point of view, we've had patients referred to us who are isolated and suffering from poor physical health and mental health. However, some patients simply don't want to engage in community-based peer supported organization. They like the GP visit and the reward of a prescription. Do you have any advice on how to engage the engageable? Sam, maybe, do you have any thoughts on that?
Sorry, I cut out for a second. Can you just put the question again?
Oh, sorry about that.
Not very good connection.
But yeah, it's just someone from the social prescribing perspective was talking about some patients that were not willing to get involved with community-based organizations, and they were feeling more rewarded by having a prescription when they went to the GP. So how can we deal with that? That kind of behavior.
The answer is a thing I forgot to say about you is your motivational coaches. It's motivational coaching, which is absolutely critical. This is the secret, I think, of social prescribing. Do you know what I mean? That's why I never quite like the idea of a link work or anything like that. No, you are motivational coaches, and that's what GPs really need to do. So everything is a negotiation. Everything is a partnership with patients. It's sitting there and you use all sorts of techniques. Do you know what I mean? Techniques that you'd use on members of your family too, saying, oh, that's fantastic, well done. Do you know what I mean? You think of all the techniques you use with everyone, particularly in your family, and use those on people and find out where they're at. So it's no good me saying to some people, you can say to some people, look at your app on your iPhone and count 10,000 steps. No, find out where people are, what's possible for them to do. Do you know what I mean? If they just get to walk to the shops every day to pick up the newspaper, that's great. And sometimes an animal is a perfect way actually to motivate people to be active. Sometimes it's not. The animal can just sit at home, but actually it's finding what matters to people, what's important to them. And once you've captured that, then you focus on that and what's important in their lives. You all do it naturally. And as I say, to me, that's the most powerful thing. There's no point. Doctors are sadly trained to diagnose and prescribe and expect that people will get better. It doesn't work. I can tell you that actually the studies that are done literally straight after leaving the consulting room, you will remember max 40%. And tons of studies which really challenge the idea of compliance on drugs. So the conversation I always have with patients, well, here's your choices. It's a bit like the COVID situation, isn't it? Yeah, look, there are risks if you go out, but these are the choices, these are the risks. So it's helping people also to understand risks and probabilities, which is really important. And most of all, just being very gentle, which you all do naturally. I mean, just being very gentle and not being prescriptive. That's really, really important. I mean, don't get me wrong. There are occasions, by the way, this is usually what I'm about to tell you, how I will behave with other doctors. So when other doctors come in, normally they've read everything. They think they're going to die of cancer tomorrow. Do you know what I mean? They're terrified because they kind of know all the information. And there are the odd occasion where you need to say to that doctor, no, sit down. I'm just going to tell you what to do. I'll sort this out. And you see the great relief come down on them. So there's also something actually, yes, in partnership with the patients, but there are moments where you need to take their anxiety, pain, and suffering onto your shoulders, whether you're a social prescriber or a professional. And that's really important to understand. And it's a combination of what the patient might want, but also your professional recognition of what they need in those circumstances. It's really, 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 really important actually to understand that. And that's about really picking up those messages which the patients are giving you. I mean, one of the other things that defines you as social prescribers is emotional intelligence. And unfortunately, in medicine, there are sub-doctors who don't have emotional intelligence. Luckily, we have jobs for them. Anaesthetists, surgeons. Sorry, I'm being a bit wicked. I hope there's no anaesthetists or surgeons there. But you get my point. But in social prescribing, emotional intelligence is absolutely critical. And your love of people. I love EastEnders. All my difficult patients, actually, it's one of the things why I've loved being a GP for 30 years. I go in to work most of the days with a spring on my step because people are just so interesting. They're so fascinating. And there's always something you can learn from them. And that defines you too as social prescribers, is the desire to learn and that sense of actually the opportunity to listen to somebody talk is quite fascinating. I mean, the insights I have as a GP and the telescope into people's lives is just quite extraordinary. And trust me, I've seen everything over the years. I've had to deal with the Cray brothers mafia. I had a number of patients from there, the dock workers in the 60s who led the strikes, psychopaths, it's not all bad, by the way. So really kind, good people, but actually all fascinating, all really interesting. And I suspect that defines you, as you have a great curiosity about people's lives and how you can help them. But I would leave you most of all with just that thought, motivational coach.
That's great. Thank you so much, Sam. Yolanda and Alice, do you have anything to add to that? Maybe not.
I don't think I do. I'm still just kind of everything's going around in my head. I'm still thinking about it, so nothing immediately.
All right, I can see a lot of people are sharing their own experiences, and that's really, really good. Yeah, people are really agreeing with motivational coaching. So yeah, it's I can see a lot of reactions, and what I will be doing is sorry, I will be sharing all of the different what I'll be doing is I'll be sharing all of the different recommendations that people have been putting in the chat. So that will be sent to everybody. Sorry.
Can I just say one thing more, actually, because I'm looking at some of the comments here, actually.
Yeah.
I'll tell you a story. I was at a conference at the King's Fund, and there were all the top leaders of the NHS there. And a very senior person in Public Health England got up and said to me, social prescribing, what a ridiculous word. You know, it's social, it's prescribing, isn't that biomedical, etc. And you could see her winning over all the audience. And I had to answer the question, and you could watch people's eyes. They were thinking, I could see them thinking, Sam, how the hell are you going to get out of this one? Because it's a very odd descriptor, isn't it? And I looked at her and I just said very, very clearly, you're entirely wrong. It is the right word. And then there was a hesitancy, and you could see people in the room thinking, oh my God, he's taking her head on. And then I said, but I need you to keep a secret. I tell you the real reason we called it social prescribing is it's a secret conspiracy to re-educate all the doctors and nurses in the health service using their language. And that's the key to all of this. We have a problem, actually, in that so many doctors and nurses are taught just to prescribe and don't understand the breadth of the prescription that's needed. Something I realized 30 years ago when I started as GP was my utter limitations in what I could do with patients if all it was prescribing drugs. But you have a training system in this country that is still based on biomedicine and a prescribing or cut it out philosophy. And so helping them understand something very different is really important, which then brings me to my key point is GPs are incredibly influential. And the vast majority of the time, that's for good. Interestingly, we are the most trusted professional in the country. Not surprisingly, lawyers and journalists are at the bottom of the pile. And when that shipman killed all those patients, bizarrely, the trust rating went up 1% the following year. So why is some of this? And part of it is because actually people have a very close and often long-standing relationship with GPs. But you need to help the GPs, and you're in a really powerful position to do that. So you can ask them for help. Actually, if you are very clear what you need them to ask patients to do, go and tell them. Actually, most GPs would really value that support, particularly with complicated patients who keep on coming backwards and forwards and you're struggling. It's lovely if somebody's got a chest infection, you give them an antibiotic, it's easily solved, but the vast majority of our patients, it's very complex. And having other people's insight and ideas is absolutely vital. It's why, for example, in the practice, we have huddles virtually every day. We actually now consult together in rooms on the telephone. So we're constantly talking to each other, picking up ideas from each other, picking up suggestions. So see yourself as somebody who can enormously help the GP, and don't ever hesitate. I mean, some of them are not easy. They're like the rest of society, but actually the vast majority of them would enormously value your help and insight. From the patient's perspective.
That's great. Thank you, Sam. And I think we're going to end this webinar on this note. I can see a lot of very appreciative comments about you, Sam, in the comments. So I think you've inspired people in the chat. So yeah, we'll be going, just before we go, so some of you have already filled in just a couple of questions about what you thought about the webinar. That's helpful for us. If you have any more feedback, please do message us at insights@bbbc.org.uk if you want to suggest any topics. And if you want to give us any more feedback, please do get in touch. That's always helpful for us. And then our next webinar, so we have an essential session, so about the Bromley Bible Centre itself. That's going to be held on the 13th of October. And on the 20th of October, we have our next webinar on how we're coping with the situation at the moment, with the risk of a second lockdown, etc. So we'll be talking about this all together on the 20th of October. I saw also people were asking about motivational interviewing and coaching and some training that's available. So we also have some social prescribing training, including for motivational interviewing here at Bromley by Bo within my team. So that's, you can get in touch as well, either at the same email address or I'll put it in the chat. It's social prescribing training at bbbc.org.uk. So please do get in touch as well if you're interested in training. We have that as well. All right, so thank you so much, Sam, Alice, Yolanda, for your participation today. It's really appreciated that you are taking the time out of your day to present to everybody and share your experiences. And we've had a lot of people today. So yeah, it seems like it was a good webinar for everybody. So yeah, until the next time, I'll say bye to everybody then.